Environment check. It's my patient on the bed. Note card with the muscles, joint play, valgus stress test. My computer to prop the iPad up, but it is off completely. It's where I'll be sitting. Okay. Hi, I'm Krista. I'm the student physical therapist. Today what you can be expecting from the session is I will be seeing the strength or testing the strength of the muscles in your feet and also the integrity of your joints. For testing purposes, I'll be placing my hands on you. Is that okay? Mm-hmm. All right. So the first muscle that we will be testing is the flexor digitorum brevis. This originates at the calcaneus via the calcaneal tuberosity and plantar aponeurosis. It inserts onto the middle phalanges of toes 2 through 5, and it's responsible for flexion of the toes 2 through 5. It's innervated by the medial plantar nerve S1 to S3. So I will be stabilizing the patient's foot medially and placing my fingers through their toes. So I'm going to apply some pressure, just resist it, okay? And hold. Good. The next muscle we will be testing is the flexor digitorum longus. It originates at the proximal medial shaft of the posterior tibia, and it inserts onto the distal phalanges of the toes 2 through 5. It's responsible for flexion of the toes 2 through 5, and it's innervated by the tibial nerve S2 through 3. So I'll be stabilizing medially and I'll be applying pressure, so hold. Good. The next muscle is the flexor hallucis brevis, which originates at the cuboid, the lateral cuneiform, and the posterior tibial tendon. It inserts onto the proximal phalanx of the hallux. It's responsible for flexion of the great toe, and it's innervated by the medial plantar nerve S1 to S2. So stabilize medially, palpate the proximal phalanx, point your toe down, good, and hold. Good. The next muscle is the flexor digitorum, flexor hallucis longus, which originates from the posterior fibula and interosseous membrane, inserts onto the distal phalanx of the hallux, and it's responsible for flexion at the great toe. It's innervated by the tibial nerve S2 through 3. I'll stabilize medially, palpate the distal phalanx, and hold. Good. The next muscle is the extensor digitorum brevis. It originates at the calcaneus, the superlateral calcaneus, and it inserts onto the middle phalanges, the toes 2 through 4 via the extensor digitorum longus tendon, and it is responsible for extension of the lateral toes. It's innervated by the deep fibular nerve S1 to S2. Then the extensor digitorum longus originates at the lateral condyle of the tibia, and the lateral condyle of the tibia and the proximal fibula. It inserts onto the distal phalanx of the toes 2 through 5, and it is innervated by the deep fibular nerve L5 to S1, and it is responsible for dorsiflexion. So I'll be stabilizing medially. You can point your toes towards you and resist. Good. Okay, so that concludes the manual muscle testing. I will be now performing joint play on the patient. Moving my laptop so there's a better view. Okay, so you can place your hand at the edge of the bed. Let's see if that's better. Okay, so you can place your hand at the edge of the bed. This. Okay, so I will be palpating the distal radius and ulna, the fifth metacarpal, and the CMC. Compress the skin. This will be a Palmer glide, so I'll be gliding towards the floor. Any pain with that? Okay. Then we will be doing a dorsal glide, which is going up, so keeping the same position. Compress the skin, and then moving up. Good. Radial glide, which is towards the thumb. And then an ulnar glide towards the pinky. Good. Okay, now we will be doing the valgus stress test. So take the patient's arm, place my hand on the medial condyle of the femur and the proximal ulna, applying 30 degrees of flexion, and placing my hand on the distal forearm and moving outward. Good. Any pain with that? Okay, and that concludes the end of the examination.